Alright, incision.
Hello and welcome to this point of view surgical breakdown of a percutaneous hip pinning for a femoral neck fracture. Once the patient is positioned and draped, we begin by making a small incision on the lateral aspect of the hip. Under the guidance of an intra-operative x-ray machine called the C-arm, we use guide pins to start the process of fixation. We insert these pins with a power driver through the outer cortex of the hip and into the femoral head. The goal for this surgery is to provide stabilization for the fracture so that it can heal properly without displacing. Inserting these pins with the correct trajectory and location helps achieve this goal. Using multiple angles and frequent shots with the C-arm, we assess the path of the guide pins to fine-tune the direction as needed. With the first pin positioned, we continue with the insertion of the second pin. With one pin situated, it is much easier to insert the other pins as we can parallel the pin trajectory and simply confirm with the C-arm.
X-ray. Sounds like a good movie line. X-ray. Alright, let's have another one. Picture. Picture.
Once the second pin is placed, we insert a third and final guide pin. These pins together form the shape of an inverted triangle. This configuration provides stability against fracture shifting, as well as shearing and rotational forces that could affect bone healing.
Save that. Let's get the lateral one more time.
With the pins in acceptable alignment, we use a calibrated depth gauge to measure the length of the pins. With this measurement, we select a cannulated screw of the appropriate diameter and length to insert directly over the pin.
90? That's 90.
90 on the inferior?
Yep.
Anterior?
87.
Yeah, the anterior one measures 87, huh? So probably have to do an 85, do you think?
85.
Or should we do a 90 and a washer?
Do that.
Let's do a 90 and a washer.
90 with washer for anterior.
With the measuring complete, we insert the screws with a power driver. We use short threaded screws instead of fully threaded to obtain compression through the fracture. There is no need to pre-drill for this hardware as the cutting flutes on the end of the screws easily enter into the bone. Once the screws are implanted, we remove the guide pins and begin the final phase of surgery, which is closing the wound. We use a strong dissolvable suture to close the deep layers of tissue. This helps to minimize bleeding and hematoma formation. On the most superficial layer of skin, we use staples to complete the incision closure. There are multiple ways to fix a femoral neck fracture. We have demonstrated just one method. Stay tuned for more videos upcoming for additional femoral neck surgical techniques. The patient's health and the fracture pattern were big determining factors into surgical planning for this patient's hip pinning. Given the minimally invasive nature of this procedure, patients tolerate this well and feel significant pain relief with the hardware stabilizing their fracture. After surgery, patients will be weight-bearing as tolerated and work closely with physical therapy teams for mobilization and strength training. Thank you for joining us on this surgical walkthrough. Make sure to subscribe for more point of view insights into the orthopedic trauma OR.